This is Healthcare Today with your host, Kelly Roberts.
Welcome to Healthcare Today. On today's show, I'm on location at Crisp Aesthetics, and I'm joined by nurse practitioner Marcy Christmas. Thank you for sitting down with me.
Thank you.
Now, you have a vast clinical background. Say you've done nursing for 17 years?
Yeah, well, I've been a nurse for longer than that. We won't say how long, but
Okay.
yes, I have been a nurse for quite a while. But I've been a nurse practitioner for about 17 years, yes.
Okay. And you've seen all kinds of patients. You've taken care of all types of patients?
Oh, absolutely. It's been a lot of fun. I worked in a clinic most of the time, a primary care setting. And so we did a lot of acute, we did a lot of chronic, and everything in between. So.
Okay, and you're originally from here?
I am from Cordell. I've been here my whole life. And so I'm very familiar with the community and the patients.
Okay, great. And the one thing about you being here, which is so nice, is your clinical background. So like you said, you've treated people that have had a lot of medically comprehensive diseases.
That's right.
And now you're just making them feel good all the time, right?
Absolutely. I've had a good following. They come over this way as well, so I've been really excited about that. Been very supportive.
And tell me a little bit about what you do here at Crisp Aesthetics, just in general.
Well, we have a medical supervised weight loss program. We have a laser that offers a variety of services. We have a new professional skin line, PCA products, where we offer chemical peels and masks and facials and things like that. And then the fun part is the Botox. Everybody loves that, so we're doing that. We're going to be introducing some new things this year that we're very excited about, so we want people to keep in touch with us about that. Yeah. I won't reveal those just yet, but we're real excited about it.
And so with your clinical knowledge, you're really able to help take these patients and kind of guide them in a direction they need for whatever service?
Yes, exactly. I mean, when people come in, sometimes, everybody thinks they're a candidate. And so we have to really look at their medications, what their chronic conditions are, and I'm alert to that because I'm familiar with those things. So if someone comes in and they're on a plethora of medicines or they have a large amount of chronic conditions, they don't always qualify for these programs, and so we try to tailor it specifically to their needs, and what they can do. And if for some reason they didn't qualify for one of our diet programs, for instance, we do have a registered dietitian that we can, send them to for further counseling. I can help them with nutrition counseling. So it just depends on the patient. So we also correspond with their personal care providers too, because I want to make sure that they understand, what's going on if a patient presents to me. Because sometimes the patient thinks, that they should be able to do it, and then they're not quite sure about some of the medicines that could interact with some of the things that we would be giving them as well. Okay. So I always want to get with their providers just to make sure there's not any complications, because their health is ultimately what's important, you know. Even though weight loss is a great thing, you want to make sure that they're okay as well. Right.
And so I want to talk a little bit in detail about that. So you offer a couple of different options. One option you offer is the HCG diet.
That is correct.
Okay, so let's talk a little bit about that.
Right. That's a more restricted diet, and we really monitor the patient a lot more closely on that diet because it is so restricted with the calorie count of being 500 calories. But you get a medication every single day that you administer yourself, but you also come in weekly. We give injections weekly in the office, but we monitor you. We check your food journal. We find out how you're doing, how you're feeling on the medication, if there's any side effects. We do your weight, your measurements, that kind of thing, and just make sure that everything is going well with the diet. So we watch them really closely on the HCG.
Okay, and then that is something that you're talking about. They go home with a book. This book is guided.
They do.
Tell me a little bit about that, because that book has a lot of information in it.
Yes, it does have a lot of information. So we go over everything in the office, but it does get overwhelming because it is such a large amount of things that they have to cover. So we have a little bag that we send them home with. It's got their patient guidebook. It has their cookbook. It has a program tip sheet. It has a shopping list so they can actually take it with them to the store. It tells them exactly what they can and can't have, And so the guidebook's kind of their Bible per se, and they refer to that. And of course, if they have any questions at all about that, I'm available all of the time. I tell them to call me anytime, so I can go over it with them, because it can get confusing at times.
And you're hand holding them through this process.
Absolutely.
But it's a great, if they qualify and they're a candidate for this, you're seeing patients have a lot of results. Talk to me a little bit about some of these results.
It's amazing. I can't tell you enough how surprised I was even at how much weight people lose. If you really mentally prepare yourself for it, which you have to do anytime you diet or do anything that you want to make a change for yourself, it's amazing the results. I've seen women just bounce out of here because they're so excited, you know, with the weight loss. And the men especially too. You know, you don't really think about men coming in for diet programs, but the men have done phenomenal as well. So we've been really excited with the weight loss.
Okay, we're going to take a quick break. When we come back, we're going to finish talking about some of those other plans. Stay tuned and we'll be right back.
If you or someone you know and love is struggling with the use of alcohol or drugs, Crisp Regional Hospital has a detox service named New Vision. We provide short-term services, typically only 3 to 5 days, to be able to help people who want to stop the use of pills or alcohol and start their journey on recovery. We help with aftercare planning, and we can refer any patients who would like to use our service. Please give us a call. New Vision at Crisp Regional Hospital.
Tired of struggling with failed diets and feeling like you're alone in the weight loss battle? Crisp Aesthetics offers a variety of medically supervised weight loss solutions, which include HCG, nutritional counseling, lipotropic injections, appetite suppressants, and other custom weight loss programs. Call Crisp Aesthetics today for a free consultation to start your new weight loss journey.
Welcome back, and once again, I'm on location at Crisp Aesthetics, and I'm joined by Marcy Christmas, nurse practitioner. Now, before we went to break, we were talking about the HCG diet, and actually yours is kind of a little different. It's been viewed on Dr. Oz and some things like that. Tell me about it being the Clean Start.
Well, Clean Start is the program that we use, and it is very specific in that it has all the materials just laid right out there for you. The shopping list is a little bit different than some of the other clinics that you might see around with the different types of foods that you eat. It's very straightforward. It's not hard to find these foods. You can go to your local grocery store and get everything that you need, so it's not some complicated diet where you're trying to figure out, what is this item,
Right.
Where do I get it, that kind of thing. So it's very straightforward, and it has everything that you need right there for you. People that have tried the diet maybe at other clinics say, well, why is this not on there? And basically, what Clean Start talks about is how your body breaks the foods down. So where the calorie count or the glycemic index for a certain food might be the same as something that was on another food list at another clinic, but they feel like it's the way your body breaks that food down that helps you lose the weight in a different way than you might on another type of food.
Okay, and reading a little bit about this diet, so I'd be totally fine with the first 2 days.
Yeah, the first 2 days are your loading days. That's what they call them, the loading days. That's the gorge menu, where you can eat anything and everything that you possibly ever dreamed of eating. That's the fun part. But that actually is day one of the diet. So day one, you eat all you can eat, all this fun stuff, and we give you a sample menu of all the shakes and the fries and all that kind of stuff that you can have. But that's when you actually start the HCG, because it takes 3 days for the HCG to get on board in your system, okay? And so once day 3 hits, though, that's when you start your 500 calories. And the idea behind the loading days is it builds your fat stores. So that first week is not so hard when you're coming off of all those things that you're used to eating.
Okay.
Yeah.
And then the nice thing is, like you said, you go to the store and you buy real food. I
Yes.
noticed some of the recipes included Italian meatballs. I saw fried chicken on there. So this is something people can kind of maintain as a lifestyle.
That's right. Yeah, you can. And once you get through the hard part, which is the 500 calories, obviously, there's a 23-day program and there's a 40. And it just depends on how much you're wanting to lose as to how far you decide to go. But what people really need to keep in mind, you need to mentally prepare for it, and you need to set your calendars aside and say, okay, for the next 23 days, I'm going to focus on this. I'm not going to go to some big wedding. I'm not going on a vacation, having some big event that's going to sabotage you right out of the gate. Right. You need to know and just be prepared for that. And then once you complete the HCG portion, we take you into a maintenance phase where we follow you closely again for another 6 weeks. You come in weekly, and you get to move your calorie count up to a normal calorie, like 1,200 for women, 14 to 16 for men. And you're just eating the right foods. So we maintain you through all that as well.
Okay, good. Now, for someone, we mentioned a little bit about this earlier, that may not be a candidate. You have other options and some new stuff. You were talking to me about injections. Talk to me a little bit about that.
Well, for people who don't want to do the extreme diet, the HCG, there's a lot of people that just need that little boost to curb their appetite. So we do offer appetite suppressants, and a lot of people are familiar with those, but they do help. It just serves as a crutch, if you will, just to kind of help you not be so hungry for those things that you know that you don't need to have, and eat just choose a healthier choice. And so we do those. If you're a candidate as well, of course, we look at your medical background, your chronic conditions, your medications. And lots of people like to couple this appetite suppressant with our lipotropic injections. That's a big seller. Everybody loves those. It gives them a little pep in their step. It is packed full of vitamins, several things. It gives you a little energy boost. And it also helps the liver process fat out of the bloodstream when you're on a healthy diet. So you can choose to get those weekly, bi-weekly, monthly, just kind of however you feel like you want to do it. So we tailor it based on the patient's needs and how they feel.
Okay, and again, you can also bring in a certified nutritionist if they need.
If someone, was unable to take, the appetite suppressant and the HCG wasn't a good fix for them either, then we can always do diet counseling and just help them with some lifestyle modifications, give them diet materials, refer them over to the dietitian at the hospital. She is very capable of going over certain diets for certain chronic conditions, whether you be a diabetic or, have high cholesterol or whatnot.
Lots of great options to get people. We're going to take another quick break. Stay tuned and we'll be right back.
Crisp Regional Hospital is home to some of the most renowned healthcare professionals, using the most innovative lasers in advanced, minimally invasive, and robotic surgeries. It's all about making the right choices to fuel our good health. It's about who we are and who we want to be. Here's to making a difference in the health of our community. Crisp Regional Hospital. We go farther so you don't have to. If you want to feel and look younger, Crisp Aesthetics is your solution. They offer a wide range of services, which include laser treatments, anti-aging facials, chemical peels, Botox, acne treatments, hair removal, and much more. Crisp Aesthetics is also your PCA Premier Skin Line provider, which includes a full retail line of medical-grade physician-approved skincare. Consultations are free, so call today and make your appointment at Crisp Aesthetics.
Welcome back, and once again, I'm at Crisp Aesthetics, and I'm joined with Marcy Christmas, nurse practitioner. Now, when we went to break, we were covering all the great services you have for weight loss, but you also do some other things with lasers. So talk to me a little bit about that.
Yes, we do have laser treatments. We have laser treatments that treat laser hair removal. We have skin rejuvenation, hyperpigmentation issues like sunspots, things like that. People that have vascular issues, whether it be the spider veins or just a redness to their complexion, it treats those kind of things as well.
Okay, now hair removal, that is something we hear more and more of these days, and it's not just women.
Oh yeah, men love it too.
Okay, so talk to me a little bit about that. What all's involved in that?
It's a simple process. You come in, it's not painful like a lot of people think.
Right.
And we even have a cooler for an added comfort. But we treat any area on the body that people want hair removed. As long as the hair is a dark pigment, or darker pigment, not blonde, it does not pick up on blonde. Dark pigment, we can treat anybody for any type of hair removal they want. Sometimes men come in and they want their beard line defined and not have, extra little hairs up here on the cheeks that they have to shave. So we'll draw that off and define that. If they want their backs done or their shoulders, and of course women have the obvious, their legs, axillary area. You can even do the bikini line, just anything that you want to do, really.
And does it last?
Yes, it does. It's a permanent hair reduction. It usually takes about 6 treatments. We start off every 4 weeks, and then it kind of spreads apart as the hair follicle starts to shrink. So it works out really well.
So usually after they get to that point and the hair follicle is gone, then
Yes.
it's a kind of a permanent?
Yeah, it's kind of a permanent thing. Yeah, I was reading an article the other day talking about how much time women spend shaving in a lifetime, and it's 72 days.
Oh wow! Yeah.
So, not to mention all the razor burns and the
That's
cuts
right.
and the razors we have to pick up all the time.
Or
So,
the waxing.
Yeah, and the waxing.
And that's a costly thing right there. So probably
Absolutely.
if you could have a
And
permanent.
this is actually a lot less painful than waxing. So,
Okay, great.
yeah.
And then as far as, now we're going to talk a little bit, you mentioned spider veins. Those are those purpley little lines people
Yes.
don't like on their legs
Yes.
or that might
Yes.
keep us from wearing. Talk to me about what the laser does for
Yes,
that.
the laser just basically erases those lines, as long as they're the little fine lines and not the ones that are rope-like, which we have someone at the vein center that can take care of those. But if it's the little spider veins that a lot of us women get standing on our feet long hours, we just go in and the heat just coagulates that vein and it just basically erases it. Sometimes it takes several treatments, but it's amazing the results.
And not a very painful procedure?
Not at all. Mm-mm.
So a lot of these people are probably not having things done for fear of that because...
Absolutely. Well, the lasers have come a long way. You know, back in the day, you know, a lot of things was electrolysis and things like that were a lot more painful than it is now. And it does have high heat, but it's a quick pulse, and so you're done rather quickly. And we do have, you know, a new cooling agent that we use, so it's very pain-free.
And again, with your clinical history of being a nurse practitioner, some of those, like you said, the vascular, you know when to make recommendations.
Oh, absolutely, yes. We know right away if it's something that the laser will take care of or not. So we don't give anybody any kind of, you know, false hope that it's going to work. If it's not, then we'll send them where they need to go to get it taken care of.
Okay. We're going to take a quick break because when we come back, I want to talk more about the anti-aging with the laser and all the fun stuff. Stay tuned and we'll be right back.
If you or someone you know and love is struggling with the use of alcohol or drugs, Crisp Regional Hospital has a detox service named New Vision. We provide short-term services, typically only 3 to 5 days, to be able to help people who want to stop the use of pills or alcohol and start their journey on recovery. We help with aftercare planning, and we can refer any patients who would like to use our service. Please give us a call. New Vision at Crisp Regional Hospital.
Tired of struggling with failed diets and feeling like you're alone in the weight loss battle? Crisp Aesthetics offers a variety of medically supervised weight loss solutions, which include HCG, nutritional counseling, lipotropic injections, appetite suppressants, and other custom weight loss programs. Call Crisp Aesthetics today for a free consultation to start your new weight loss journey.
Welcome back, and once again, I'm on location at Crisp Aesthetics. Now, before we went to break, we were talking about the lasers and all the treatments that you can do, the hair removal and the spider veins, but you mentioned some other fun stuff, anti-aging.
That's right.
Tell me a little bit about that.
Okay, so one of the light sources that we have does help with photo rejuvenation and collagen stimulation, which is good for wrinkles and fine lines, which we all want to get rid of.
Right.
So it just depends. And when a patient comes in, I just ask them basically, what's bothering you the most? When you look in the mirror, what do you see? What stands out to you? If someone has a dark spot on their face and they're like, this spot right here. So I'll take a laser and I'll just, you know, work on that one spot. But if it's a generalized thing where they feel like it's a, you know, overall they just don't like the pigmentation, if there's, you know, it's uneven skin tones, I may say, oh, okay, well, let's do the IPL, which is the intense pulse light therapy, which, you know, kind of helps even out skin tone, but it also stimulates collagen. It takes out red tones, it takes out dark tones, and it just gives you a really brighter, you know, look. And in turn stimulates collagen as well. And that's an absolutely great treatment. And you don't just limit that to the face, it can be used anywhere on the body. So lots of times women do like to leave their neck and décolleté area, even their hands or their arms if they have a lot of freckling or spots. You know, a couple of weeks ago I had someone in here and I used my forearm as, you know, an example. And so after the treatment, my arm on one side looked like a Dalmatian because it brings to the surface all of the pigments and it darkens those, and then they just slough off. And then it's gone. It just gives you a cleaner, more clear complexion.
What about sunspots and things like that? Being in the sun, because we all, especially years ago when we didn't know that it was bad to lather up with baby oil and lay in the sun. Tell me about a little bit those dark spots.
Yeah. So as women age, you know, when we're laying in the sun, we don't think about it. But years later is when they show up because the damage is going on under the surface at the time. But it's going to rear its ugly head, and they're going to come in and say, well, I have all these spots now, and I used to not have these spots. So that's one thing that really the laser keys in on. You know, we have several different light sources depending on where it is, the color of it, you know, how large of an area it is as to which one we use. So it just depends after we do an evaluation as to what we do, but we have great success with those.
Okay, and you mentioned some wrinkles. Now tell me how it works with the wrinkles.
So what we do is we use one of our lasers, actually it's the 1064, and we just take it and we go over the entire face with lots of different little pulses, and it just heats up the skin, and it actually feels really good. It's not a heat that you're, you know, squirming around in the chair over.
Right.
It's just a nice warmth, and it just heats up the tissue underneath, which stimulates that collagen. And helps, you know, with the anti-aging process.
Okay, and then what kind of downtime?
There's absolutely no downtime with this one. This is a non-ablative laser. There are lasers that are ablative, like the CO2s and things like that, but this is a non-ablative laser, so there is no downtime with this one.
So they could have it done in the afternoon and be
Absolutely.
back at work with their makeup on?
Yes, and and know that it is a process. You don't have one treatment and all of a sudden you're like you're in your 20s again, obviously.
Right.
But it's a process, and it's something that you just keep, you know, coming in for 4 to 6 treatments.
Okay, and again, they come in for a consultation. You kind of help guide them in what they need.
And we like to couple it with other things too, you know, depending on the skin condition. Nothing's cookie cutter with anybody. So when we have a variety of services, we like to couple, you know, whether it be a peel or a mask or, you know, a light therapy. It just depends on what their needs are.
And I want to bring this point up again. With you having that clinical background of being a nurse practitioner, you may sometimes find out that there's underlying conditions.
Oh, absolutely. In fact, going back a little bit, I had a lady come in at one point, and she was here for the dieting. And I happened to look down, and she had on a short sleeve shirt, and I looked at her arm, and I said, "Oh, wow, you've got this mole on your arm." And she's like, "Yeah, I've been going to go see about it, and I haven't done anything about it." And come to find out, I referred her to one of our surgeons here, and she had melanoma.
Oh, wow.
And so she just came in for diet.
Wow.
Wasn't even looking at her skin. So yeah, you know, it is nice to have a little bit of clinical background because people just don't pay attention to little things that are important like that, and we're all so busy, they tend not to go get it seen about. So that is an advantage for sure.
Okay, we're going to take a quick break, and when we come back, we're going to find out about some other good services and products you offer. So stay tuned, and we'll be right back.
Crisp Regional Hospital is home to some of the most renowned healthcare professionals, using the most innovative lasers in advanced, minimally invasive, and robotic surgeries. It's all about making the right choices to fuel our good health. It's about who we are and who we want to be. Here's to making a difference in the health of our community. Crisp Regional Hospital. We go farther so you don't have to.
Welcome back, and again, I'm on location at Crisp Aesthetics. Now, going back to break, we were talking about lasers and all the great things you can do for anti-aging and wrinkles, but you also offer chemical peels. Tell me about those.
We do. We have a professional skin line, PCA, which we love. And you know, there's a big misconception about chemical peels because I'll have people call and say, am I going to be able to go out in public? You know, how long am I going to be down? How am I going to look? Is my face going to be red? You know, and the great thing about PCA is these peels are self-neutralizing. It's not a peel that you have to put on and then take off and you look, you know, really red or burned or anything like that when you leave here. You actually have a good, shiny, taut, tight look when you leave, which is what we all want anyway. So there's a big misconception. So I wanted to reiterate that with PCA. It's a great product. And so chemical peels are something that's a maintenance thing. You can come in and do them monthly, which is what I recommend. And if you have some other issues, it's really nice to couple it with the laser treatments or the IPL. But anytime someone's wanting to start some kind of new skin regimen to improve their appearance, I always recommend doing a chemical peel first because it gets rid of some of those cells, because the whole idea behind it is the cell turnover rate. Because as we age, our cell turnover slows down. And so it gives us more of a sluggish, dull appearance. And we want that bright, you know, shiny, good-looking appearance that we had when we were a lot younger. So it helps increase the cell turnover. That's what a chemical peel is all about. It's not about how much you peel, because some people really just have, mostly with these peels, mild flaking. So you don't really have a noticeable difference when you're out and about and you're wearing your makeup and somebody's like, gosh, what happened? You know, what did you do? You know, you just go about your business and it's like you really didn't have anything done. But it's what's going on underneath at the cellular level. So and we also offer masks that we use for different things as well. We treat acne. We have masks for that. We have peels for that. We have peels for pigmentation issues, because it's not just one solution. There's several different types of solutions based on what it is. If you come in and you're like, oh, it's the fine lines and wrinkles, then I know which peel I want to use. If it's, well, I have the fine lines and wrinkles, but I also have some pigmentation issues, well, I can always layer the peels. It's not like you just have to use one product. We can, couple products together.
And again, I keep going back to this, but it's so important. With your clinical background, you can sometimes tell if there's something underlying, like a skin condition.
Oh, absolutely.
And then you're able to treat that.
Yeah, well, you want to differentiate a lesion that's dark. You want to make sure it's not a cancerous lesion, that it's really just a benign lesion that is caused by years of sun damage or something like that. So that's important as well. Because there are people that we have to refer out. You're like, no, that's something that really needs to be looked at and it might actually need to be surgically removed.
Right, and there's no age limit, like you've waited too late to start, or you can always start younger. So talk to me about taking care of
preventative is such a big deal. We all wish that we'd have done things differently, but now there is such, information and awareness out there that there's no reason for people not to take those cautions. Sunscreen obviously is your number one thing. Limiting your sun exposure and smoking cessation. Because a lot of the women will come in and have the wrinkles around the mouth and all, and it's from years of smoking. So there's a lot of things that you can do that are preventative, and of course home products. Even if you don't use a professional skin line, just doing something at home, because all the literature states that 60% of what you do is at home. You can come in and we can certainly do all these treatments for you, but if you go home and continue the same lifestyle and do nothing to help what we've tried to accomplish, then you're going to be back at the same. Right. At the same spot you started.
And I want to talk again about these lines. They're great lines, this PCA. So I did a little bit of research and they've won a lot of beauty awards, but they're really good for that professional grade.
Absolutely.
Treating again, let's talk about it, the pigmentation, acne, things like that.
Yeah, rosacea, melasma, any hormonal changes as women age. Lots of times they'll have pigment changes due to hormonal, changes. So we can treat a lot of those conditions. Okay. Absolutely. And we have the retail products available as well. If you're looking for a skin line, you don't have one, we do have that. We can tailor that to your needs, based on what's going on with your skin at the time.
Well, that's good, because if they've never understood or had a skin regimen, then you can kind of give them a plan and send them home,
Absolutely.
like you said, to continue on that. Well, a lot of great information. You have a lot of great services here.
Yeah, we're very excited about it.
So I appreciate you sitting down with me today, and then they can just call Crisp Aesthetics, make an appointment.
Yes, please call. All of my consultations are free. You can come in. We'll get you in really quickly and get you out really quickly, and so we're glad to have you.
Right, you're making a lot of people feel good and look good.
That's right.
And thank you for being here today.
Thank you.
And thank you for watching Healthcare Today. If you'd like more information, you can find them at Crisp Aesthetics, and they're a division of Crisp Regional Hospital. We hope to see you here next time on Healthcare Today.
Crisp Regional Hospital is home to some of the most renowned healthcare professionals, using the most innovative lasers in advanced, minimally invasive, and robotic surgeries. It's all about making the right choices to fuel our good health. It's about who we are and who we want to be. Here's to making a difference in the health of our community. Crisp Regional Hospital. We go farther so you don't have to.
If you or someone you know and love is struggling with the use of alcohol or drugs, Crisp Regional Hospital has a detox service named New Vision. We provide short-term services, typically only 3 to 5 days, to be able to help people who want to stop the use of pills or alcohol and start their journey on recovery. We help with aftercare planning, and we can refer any patients who would like to use our service. Please give us a call. New Vision at Crisp Regional Hospital.